Hello, everybody. Adam Biggleson here, and it's been a little bit since I've done a Substack. Life happens, and exciting things going on all the way around. Definitely been an interesting month, to say the least. So let's take a look at this, though. As I talk to people and do conversations based on their consultations that they've done with us, lots of things come up. So this one came up recently. Someone said to me, "What do you know about POTS?" And I thought, pots? You put plants in them? Pots? No, there's a syndrome. So, of course, there's a syndrome. And let's see, let me look this up. Let me bring you over here. This is actually Johns Hopkins Medicine. All right, hopkinsmedicine.org. Whether or not they're affiliated with Johns Hopkins University, I don't know. But postural orthostatic tachycardia syndrome, POTS. This tells me a lot right here. Uh, Syndrome means they don't know. And postural, okay, structural, tachycardia, orthostatic. I think that has something to do with posture. So let's take a look. Is a blood circulation disorder characterized by two factors? And still, right off the bat, I'm thinking blood circulation affected by posture. Without question, this makes a lot of sense to me. Part of it is looking at something like this and thinking they're so close, yet they still kind of miss the point. So it's a specific group of symptoms that frequently occur when standing upright. Okay. A heart rate increase from horizontal to standing, or as tested on a tilt table, of at least 30 beats per minute in adults, or at least 40 beats per minute in adolescents, measured during the first 10 minutes of standing. So measuring heart rate sitting, then standing, and there's a big difference. There is always going to be a difference between sitting and standing. Just getting up changes things. And the body is very dynamic. So you have to understand it's always adapting. Right now, I'm standing on one foot with one on the chair beneath my standing desk, which is a different experience if I stand on the other foot. My body is just adapted as I'm doing this, right? So, POTS is diagnosed only when orthostatic hypotension is ruled out and when there is no acute dehydration or blood loss. Orthostatic hypotension is a form of low blood pressure. All right, so talking about blood pressure. And once again, sitting versus standing. Is this going to have an effect on blood pressure? Yes. I would think sitting, we are more compressed, so it's putting pressure on the system itself, the circulatory system. Standing is something different. Standing for extended periods of time is another story. But let's take a look and see. Part of it is just looking at a conventional diagnosis and making some sense of it within the terrain perspective here. Okay. It's a common condition affecting an estimated 1 to 3 million Americans. That's a lot. Symptoms of POTS include, but are not limited to, lightheadedness, occasionally with fainting. I did get lightheaded today as it's 95 degrees out and hot. And I did get lightheaded when I stood up. Let me see here. Difficulty thinking and concentrating, brain fog. How many of you guys have difficulty thinking and concentrating? Brain fog, very common. Fatigue. Anyone? Raise your hand if you have fatigue. Everybody. Nobody seems to have the amount of reserve in the gas tank that they really want to have. Intolerance of exercise. I don't know about you, but I hate exercising. I have very little tolerance for these types of things. Headache, these things we have sometimes, blurry vision, palpitations, tremor, and nausea. Many, they're very general symptoms that we could have at any point in time. And there's more symptoms too. So the reality is, as far as I'm concerned, they could diagnose with any one of us with POTS. Researchers don't fully understand the causes of POTS. What else is new? It's more common in women than men and is more likely to develop in adolescents and young adults. Okay, that may say something. There's a pattern. Diagnosed either using a 10-minute standing test. So stand for 10 minutes. I stand for most of the day, by the way, since I've gotten my standing desk. I am actually surprised at how much I stand. I stand in the beginning of the day, and typically I don't sit till evening time, till dinner time. Naturally, I'm not forcing myself to do this. My body's happier that way. POTS is diagnosed 10-minute standing test or a head-up tilt table test. And I looked this up, head-up tilt table test. This is this. So they strap you into a table. And first of all, for me, look at this picture here, this guy. That would cause my blood pressure to change. Don't know about you. Going into the hospital causes blood pressure to change, but basically, still, they have you lying flat and they do blood pressure, then they tilt you up and they test blood pressure. Do they leave you strapped into the Frankenstein table for 10 minutes or not? I'm not sure. Either way, last part here, most people's POTS symptoms respond to a combination of diet, medications, physical therapy, and other treatments. We could take out POTS. Most people's symptoms respond to a combination of diet. So, yes, once again, you can see how there's a lot of generalization, unknown, but interventions are recommended. So something that we talked about the other day with Berlando, iatrogenesis, when doctors do things that interfere, cause more problems. All right. So at this point, we all have symptoms. If we listen to them and understand what they're telling us, then we don't shoot in the dark and wonder why these things are happening. Let's continue. I just want to go through the rest of this website a little bit. Nervous system. Okay, it stands for posture related to the position, orthostatic related to standing upright, increased heart rate. So basically, you have a group of symptoms that is related to your posture. A group of symptoms with increased heart rate that relate to the standing up position of your body. Why does this heart rate increase? Lower amount of blood in circulation, excessive pooling of blood below the level of heart when upright. Okay, lots of things. Either way, still, why does this go up so much, heart rate? Let me see. Unclear reasons for person to person. Blood vessels don't respond efficiently to the signal to tighten, so your body is making a mistake. I don't believe that. As a result, the longer you're upright, the more blood pools in the lower half of your body. Really, a lot of this to me is structure. First things first, all right? Get to the osteopath and align the structure of the body. With all of us, with whatever goes on, one of the first things we all need to do and understand with our bodies is releasing restrictions, all right? Adhesions that are pulling, scar tissue that's pulling, and open up pathways of elimination, aligning the body gently, not forcefully, and open up pathways of elimination. If the body's not in alignment, it's going to put pressure on the systems and it's going to affect everything. All right. It's very similar to your car in a way, where if the front right tire is out of alignment, it's going to affect the back left tire and it's going to affect your gas mileage. It's going to affect handling. So if anything is out in the body, putting pressure somewhere else or pulling internally, is it going to affect heart rate, blood pressure, digestion, energy, thought processes? Yes. Let me see here. Dun, 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 dun. Types and causes, all types of POTS. You can have neuropathic, you can have hyperandrogenic, hypovolemic POTS, secondary POTS, or flower POTS. Symptoms: fatigue, once again, lightheadedness, brain fog, forceful heartbeats, which all of us have had at some point in time, typically when structure is out of alignment, right? And there's stress involved. Nausea and vomiting happens sometimes, headaches, excessive sweating, shakiness, a pale face or purple discoloration of the hands and feet if the limbs are lower than the level of the heart. Um, they get worse in warm environments, situations involve a lot of standing. Anyways, once again, a lot of details that still seem general in a way to me, having to relate to your posture. Posture definitely will affect flow, period. So the reality is get your posture aligned. Understand how the posture works. Get to the osteopath. There are chiropractors that are working more osteopathically these days, gentle alignment, working with restrictions, all right, releasing restrictions. COVID-19 and POTS, is there a link? Not even going there. POTS and pregnancy, might want to be afraid if you're pregnant. How is it diagnosed? Can be complicated because the symptoms can affect a wide range of organ systems, and the most bothersome symptom for each patient may differ. So once again, there's probably a pretty good chance they could diagnose every single one of us with POTS. In most instances, symptoms have been present for months before the diagnosis is made. Physical exam, order blood work, and arrange for a standing test or a head-up tilt table test. Okay, let me see here. And you might have POTS of all three of these criteria. Your body produces an abnormal heart rate response to being upright. Abnormal. Okay, there's ranges there. So yes, if there's excessive, there's something that's very observable. Your symptoms worsen with upright. You don't develop orthostatic hypotension in the first 3 minutes of standing. Other POTS tests, similar conditions. Many conditions share the same symptoms as POTS. That's important. POTS can complicate any other chronic health condition from asthma to inflammatory bowel disease. And let's think of this. Asthma? Does asthma create POTS? Does POTS create asthma? Who knows? And I don't understand diagnoses in general. Do they take a group of symptoms and these are your asthma symptoms, but these are your POTS symptoms? Because there are some that don't line up with asthma, so we'll say that you have asthma and POTS potentially. Another condition is inappropriate sinus tachycardia, in which the resting heart rate is usually above 100 beats per minute. Fibromyalgia patients, those with gastrointestinal motility disorders, such as irritable bowel syndrome, excessive sweating, many other conditions can also develop POTS. So this is an interesting one. When the resting heart rate is above 100 beats per minute, what can go on there? First, let's look at the physical body. Let's align it. Let's take pressure off the system once again. All right. Energetic flow. Is there anything going on with a tooth affecting energy to an organ of sorts, potentially? Emotions. What's up with the stress of the person? Does the person hate their relationship? Do they hate their job? Things like that. So there's a lot of different things that can contribute to this. It says here fibromyalgia patients, those with gastrointestinal motility disorders, can develop POTS. For us, my dad would say, if you clench your fist for 5 minutes, your fist will hurt. If you clench your fist for a year, you have fibromyalgia. Okay. Now, if people are that tense, stressed, having fibromyalgia, is that going to affect blood pressure? Yes. But now they give you a medicine for fibromyalgia and something else for POTS. You can kind of see where I'm getting at with this a little bit. And treatments. How's it treated? Treatment for POTS should be tailored to each individual. That's very nice because the symptoms and underlying conditions may vary widely. Although there's no known cure for POTS, the condition can be managed in most patients with diet, exercise, and medications. Really interesting because osteopaths are medical doctors. They are MDs. And this is another thing that makes it kind of interesting to me that they don't really communicate amongst each other. You know, specialists, one thing, dad was a left eye surgeon, was a different guy, worked on a different day that worked on the right eye. But, are these doctors talking to each other, the specialists, the pulmonologist and the cardiologist? I don't know. What I know is when they do the specialists, then they start to miss the forest for the trees type of experience. So, no known cure. Okay. If they looked at it osteopathically, they might know a cure. Do I have people that have come to us that have had POTS and been to an osteopath and don't have that diagnosis anymore? Sure. Does that mean everybody is going to be structural? Not necessarily. At the same time, once again, it's a different way to look at this, looking for the clues. All right. Dad's hero was Sherlock Holmes, and he considered himself a medical detective. So look at the clues, right? In the words themselves of what POTS stands for says something. All right. And they've got all kinds of treatments. Does it go away? It can lessen or disappear. The symptoms may come back just as unexpectedly. The absence of symptoms doesn't necessarily mean that the cause of POTS is gone as well. So you may have it right now and not even know. Anyways, blah, blah, blah. What are your thoughts on POTS? You know anyone that's got it? Have they had any physical injuries, any accidents and scars, surgeries, things like that? Have they ever seen an osteopath? Once again, I don't know everything. I am not a doctor, but I have learned to look at health and wellness through the lens of the terrain and can tell you there are a lot of mysterious things out there, like POTS, that seem to make a ton of sense to us when you look at it through the terrain. All right. If we looked at someone's blood with POTS, which I don't have a consultation here, I'll go take a look and see. Uh, did we see structural issues? Probably. So, food for thought, guys. What are your thoughts on POTS? Hasta luego.